It was 2 years ago that the pandemic was declared by the World Health Organization and that Ottawa had its first case declared. This is what it sounded like here on All in a Day that afternoon. Ottawa has its first confirmed case of the novel coronavirus, according to Ontario's Ministry of Health. The man is currently self-isolating, the ministry says, and seems to have contracted the virus in Austria. Right now, Dr. Vera Etches, Ottawa's Medical Officer of Health, is speaking to reporters.
I would like to assure residents that as a system, we're prepared to respond to this case and to continue to support our community in monitoring, detecting, and containing this virus. I know anxiety levels can be high, and we need to help each other with seeking accurate information. Therefore, please continue to visit ottawapublichealth.ca/coronavirus.
I would, however, as Dr. Etches has indicated, urge people to remain calm and follow the sound advice of the Ottawa Public Health Unit. For example, as Dr. Etches mentioned, COVID-19 community assessment centers will be open locally, and more details with respect to the location and hours of operation will be provided. This is to take pressure, obviously, off emergency rooms in hospitals.
The testing right now is performed in emergency rooms. What we're looking to do very shortly is open an assessment center where people can receive that testing and that assessment outside of hospital.
I spoke to a woman this morning who had returned from Los Angeles and was sick, and she called Ottawa Public Health for advice, left a message, and she said she hasn't got a call back yet. It's been 24 hours now. Do you know how many calls you're receiving and what your response time is?
Yes, so the advice increased on Monday for any travel out of country, and as you can imagine, that's increased the calls to our line, people with questions. So yesterday was the first time we started to see some waits on the phone lines. We had close to 200 calls.
We're currently in the process of opening the first center. We are working very carefully with the data that we're getting from public health, the volumes of visits, and we're going to start concurrently working on opening a second center.
We are still talking about a situation here where the case is related to travel, and we're taking the measures to contain transmission of this infection by following up with the contacts. We don't have any evidence yet of
CBC reporter Matthew Cooper was watching that conference and been following this story for a while now. He joins us now with the latest. Hi, Matthew.
Hi, Alan. Now, the other thing that we know that we've had confirmed with a tech company in Canada, that's Sienna, they have confirmed that they've temporarily closed their Ottawa campus after learning one of their employees, who was recently traveling overseas, had tested positive for coronavirus, and that the campus will remain closed until March 17th. That's 14 days from when they say this employee was in the office. Out of an abundance of caution, employees have been asked to work remotely until then.
And we're getting labs in Ottawa, too, to increase the testing capacity, right?
Well, that's one of the things that's kind of been a barrier. Previously, samples needed to be sent to Toronto for testing. Now the Ontario Health Agency has labs in Ottawa. It'll help increase testing capacity, and it also means that test results will come faster, about 6 hours after it arrives at the lab.
And of course, people should just be continuing taking precautions, is what the officials are saying.
You know, wash your hands for 2 happy birthdays, 20 seconds. Use soap and water. Use hand sanitizer if you aren't able to get soap and water. Avoid touching your face, your eyes, nose, and mouth. And clean your hands before you do that if you're taking out your contact lenses or something like that. Cover your cough and sneeze with a tissue or cough or sneeze into your arm. And if possible, stay home if you are experiencing any illness, any symptoms. The virus spreads in droplets, and the radius of that is supposed to be about 2 meters or 6 feet. So keeping that distance between yourself and anyone that you are meeting or coming in contact with, roughly the length of the table that we're sitting across each other from.
The World Health Organization is now characterizing the COVID-19 outbreak as a pandemic. Earlier today, Prime Minister Justin Trudeau announced a $1 billion package to help with the health and economic impact of COVID-19. We've reached Frank Welsh, Director of Policy for the Canadian Public Health Association.
There's some money in the package to support vaccine development and current surveillance activities so that we get a good knowledge base about how this organism is spreading and how it lives and survives, so that when it actually does become a major problem in Canada, if it does, we're better able to respond.
At this point, what do you think are the messages that need to get out to Canadians right now from a public health perspective?
I think from a public health perspective, the clear big message is, all those directions you're being given about washing your hands and sneeze and cough etiquette and the like, please do them. They're going to be very important in controlling the spread. I think that has to be one clear message. I noticed that in the package there's about $50 million being set aside for communications and education components. I think that is a very important piece of this puzzle because, as you know, in this type of environment, there's all kinds of misinformation and fake news that'll be floating around. What we really have to do is get the message out that, yes, this is a new and novel organism that's going around. It's making some people sick, but if you practice some basic public health activities, social distancing, cough and sneeze etiquette, keeping your distance from people and the like, you're probably going to be okay.
That's what it sounded like 2 years ago today when the pandemic was officially declared and we had our first case here in Ottawa. Someone we've talked to many times over the last 2 years has been listening to that montage. Epidemiologist Raywat Deonandan joins me now. Hi there.
Hi.
What's the thing that leaps out most to you when you're listening to that?
Oh boy, it's been a long time. That's the thing that leaps out most. And we've gone through so many perturbations and iterations of what we thought was knowledge. And then new information comes along to change what we think about this disease. So the thing that jumped out most actually was the vociferous and certain advice around hand washing, which we know now isn't a strong defender against COVID-19. It's great for other diseases, but not necessarily for this one.
And it's interesting, even that sense of we don't even know if it's going to spread. We don't even know if this is going to be as serious as they say, which you understand. You didn't want 2 years ago to have people in a panic. Do you think more should have been emphasized about the danger earlier?
That's a tough one because you have to gauge the magnitude of the response against the potential ill effects of over-responding.
Yeah.
I was saying very early on that it might be a serious thing. We don't know. Let the professionals respond and they will let us know when it's time to panic. But that's not the way the world works. The world, it seems, works by way of amplification of small messages via social media. So the second there's any sense that something might be afoot, that was going to be the dominant narrative for a while. We're in a whole new era when it comes to communication. And that's one of my big takeaways from this past 2 years is we have to rethink how we communicate around public health and public health emergencies.
And you hear that in there, the urgency, even 2 years ago, for accurate information getting out there, the concern that misinformation could end up affecting this. What has been the biggest challenge in getting accurate information out there?
I think the biggest challenge has been the politicization and the militarization of disinformation. We did not anticipate that there were well-funded, organized disinformation agents, possibly funded by foreign governments, that were intent on exacerbating the divides in our society by pumping disinformation around this pandemic. We should have seen it coming because that was what was happening regarding other political issues around the same time. But that was unforeseen by many public health leaders, and we didn't have the resources or the people in place to combat it well enough. And frankly, we still don't. So this is a whole new world when it comes to public health communications, and I'm not sure how we go forward and make it better.
If you look back to what we were talking about that day, even the testing in hospitals versus testing in centers, and we were waiting for the testing centers to be opening up here in Ottawa, what did we learn about the importance of testing and maybe we lost some lessons along the way? I don't know about the importance to have that data.
Yeah, testing is everything. We knew that. The scientists certainly did. The politicians were slow to understand why it was so important. We also understood, but again, we're slow to implement that knowledge, that it matters who you're testing. Simply relying upon the testing of people showing up to be tested, who are symptomatic and therefore likely to be infected, doesn't give you strong surveillance information. So as the pandemic has evolved, we had to rely on a set of different kinds of information pathways, including the testing of people who are coming forth suspected of being infected, including the use of rapid tests by people who are using testing to go to a party or something, and wastewater testing. So over the past 2 years, the technology has evolved, our understanding of how to use surveillance tools has evolved, and the public understanding of what these various modalities are has certainly evolved.
I mean, you heard me asking the question about whether Ottawa was going to be getting more labs to actually be continuing with the research itself into, and there was no shortage of different, at one point we were very much targeting on vaccine only, but also understanding different components of COVID-19. What has impressed you or puzzled you about how research has been done in the last 2 years?
That's curious. Well, at the granular level, what we're funding has been interesting to watch. Are we funding treatment options? Are we funding vaccination? Are we funding the larger sociological investigations that need to be done to figure out who is most at risk from bad outcomes? I think that latter has not been focused on enough. And it's really come to the fore that we really have to invest more, of course, in the vaccine platforms, but also in improving our treatment options. Laboratory scientists are not necessarily the front warriors in this scientific war. It has been the population scientists and the medical doctors and the statisticians. I think that's been surprising for a lot of people observing this, who expected, the lab people to take a more prominent role. But anyone who understands public health emergencies understands that's not the case. The lab scientists will provide the tools. Everybody else provides the context, and decisions are made with context.
When it comes to how those decisions are made, do you think we have more or less faith in our medical officers of health, and I say medical officers of health, I guess I mean the ones that are heard in the news, or more or less faith in our elected officials to make those health decisions than we did 2 years ago?
This has been fundamentally a crisis of trust, not a crisis of health, of healthcare, or health systems, but a crisis of trust. And we had that crisis already in place prior to the arrival of this pandemic, but pandemics have a way of exacerbating these issues. Trust in authority figures, trust in the elite, of which I suppose I am, given I'm a professor, and you are as well as a media figure, trust in media, and predominantly trust in the public health leaders. This is the biggest issue. And I'm really concerned going forward when the next public health crisis comes along, as one will. Do we know how to rebuild that trust? Has the damage been done in an insurmountable fashion? I don't know. I'm very concerned on that front.
I know this is the $400,000 question, which meant it was worth more 2 years ago. But how do you fix that?
I think you got to fix it by understanding it takes decades of investment. It can't be fixed in weeks or even months. So some things can be fixed immediately, kind of like controlling the foreign disinformation agents on social media, as we have started to do in the wake of the Russian-Ukrainian war. But also you got to fix it with investing in public science literacy, not just in schools, but in the public. Right? And that means throwing a lot more money and resources to the communication of these issues as well. Most of these problems can be addressed by resources and money, and that's a good thing because that's what government is good at, spending resources and money, and we can direct that towards, again, the school system. But this is ultimately a societal issue, and I think we have to see a two-pronged approach, one from the top down for our political leaders and one from the bottom up from the citizenry. The citizenry have to demand transparency and non-ideological public health communication, and the politicians have to be open and honest and courageous to put forward policies and opinions that are for the public good, not necessarily for the political good. We have done this in the past. This is not something that cannot be achieved, but it begins with understanding this is a decades-long endeavor, not a weeks-long endeavor.
I just have a minute left here, but it was striking me that I was talking to Matthew Kupfer about the distance that droplets travel, and he said, well, it's just like the table that we're across from right now. Like I that was a time when we still had reporters here in studio with me. We're across the table from. I just wondered what the biggest shift do you think has been for you in the last 2 years?
Well, I think on that front, understanding the transmission of a disease has been understanding it's not droplet driven, it's airborne driven. So those distances don't matter as much. What matters is getting control of ventilation and mask wearing and so forth. It's a whole different game when you accept that this disease is not driven by droplets or by touching surfaces, but by an airborne virus. So And I didn't anticipate the resistance against vaccination. That's been astounding to watch, how large it actually is. That slowed down our response considerably. We have a lot of work to do, but we can still do it.
Raywat, thank you so much for everything you do and for being with us today.
My pleasure.